Hi, welcome to another episode of Medicine Simplified. In this video, we will know about XYY syndrome. It causes, symptoms, and treatment. Please remember this video is meant for medical professionals and medical students. XYY syndrome is also known as Jacob syndrome. It is a rare genetic disorder that affects males. It is caused by presence of an extra Y chromosome in each cell. We all know that males have one X and one Y chromosome. But in this syndrome, males will have extra Y chromosome. That's why it is called as XYY syndrome. Please remember, don't be confused with another syndrome known as XXY syndrome, which also affects male, but they will have extra X chromosome. Syndrome is also known as Klinefelter syndrome. Genetic variation occurs randomly and is not typically inherited from parents. That means it is not hereditary. Coming to the causes, syndrome is caused by genetic error during cell division. This extra Y chromosome usually happens because of mistake called as non-disjunction during meiosis in the process of sperm cells formation. Coming to the symptoms, most individuals with this syndrome do not exhibit any noticeable physical or developmental differences. Syndrome is identified incidentally during genetic testing. However, few individuals might exhibit certain characteristics, which include taller than average height, slight delay in speech and language development, learning difficulties such as reading and writing, behavioral and emotional challenges including impulsivity and difficulty with social interactions, mild motor coordination issues, increased risk of attention deficit or hyperactive disorder, and other behavioral or psychological issues. Coming to the investigation, XYY syndrome is often diagnosed through genetic testing such as karyotyping, which analyzes the number and structure of chromosomes in person's cell. Prenatal diagnosis is also possible through cryonic villus sampling or amniocentesis. Coming to the treatment for XYY syndrome focuses on addressing specific challenges and needs that an individual might face, which includes speech therapy and educational support for language and learning difficulties, behavioral interventions and counseling to address emotional and social challenges, occupational therapy for motor coordination difficulties, medication or therapy for ADHD or other behavioral and psychological issues if present. If you like this video, please do subscribe to our channel. Thank you.